Hi, Wendy. Hello, and thank you for agreeing to this conversation.
My pleasure.
I remember the last little conversation we had, something like this, but without cameras, was about 15 years ago. And then...
Oh, you mean when I had hair?
Well, but then
Yeah.
you had published around 130 books. In the meantime, that's up to 200.
Don't put pressure on me, not quite. It's 196 as we speak.
It's 196 of edited and authored books
Yeah.
in rational emotive
No,
behavior
no, no, no.
therapy
And general psychotherapy.
and general psychotherapy,
Yeah.
some for professionals
And some for the public.
And some for the public. And you're professor at Goldsmiths College in London
Yep.
for rational emotive behavior
Now,
therapy.
my title is Professor of Psychotherapeutic Studies.
Professor of Psychotherapeutic Studies. Okay, so is that more general than
Yeah.
REBT?
Yes, although I do run a master's in rational emotive and cognitive behavior therapy. The unit used to be called the Unit of Psychotherapeutic Studies. So I used to be a professor of counselling, but when they moved into that part of the college, the name of my professorship was changed to reflect the unit, which unfortunately doesn't exist anymore. But
Okay. Okay. So what I'd like to do, if that's okay with you, is just start off with a little bit about you and your relationship to the field and how you came into it, and then sort of narrow it a little bit more to REBT.
sure.
Perhaps widen it out and take it wherever you'd like to take it then.
Okay.
Yeah, is that
Mhm.
okay?
That's fine.
So my first question would be about the REBT concept of a healthy human being. What a healthy human being, emotionally healthy human being, how that's understood within REBT.
Well, I think the whole idea of a healthy human being, it's a bit like Maslow's concept of self-actualization. It's a striving towards rather than, there is a being who is healthy.
Mm-hmm.
The image of the person in rational emotive behavior therapy is such that people have a tendency both to be rational and irrational. And when they think irrationally, which strictly speaking largely is when they think rigidly and make extreme evaluations of things, then they tend to experience unhealthy negative emotions, to act in ways that are self and other defeating, and tend to make inferences which are highly distorted. Which, whereas if they think rationally, which in REBT is flexibly and with non-extreme evaluations, they'll still feel negative emotions when they're facing adversity, but these will be such that they will be able to act in ways that are constructive and make more realistic inferences about the implications of what they're facing. So I see the strength of REBT is actually sort of helping people to actually move away from a tendency to be rigid about certain things, to be more flexible, and to experience the benefits. But that is, as I say, a striving towards rather than ever achieving. I mean, you might achieve it in certain areas, but then go back. The way I tend to look at it. That there were some ice skaters who once got a perfect 6 at the Olympics, but if you'd asked them to skate again directly afterwards, they wouldn't have been able to be kind of perfect. So human beings, seem to be not perfectible. So I tend to think of, rather than a healthy human being, but maybe healthy human functioning.
Yeah.
Which I think all human beings are capable of.
Mm-hmm. And healthy human functioning, I guess, in the various contexts of life as well.
Oh, yeah. Yeah.
So that people would usually come, I guess, in times of adversity. And I'm wondering what kind of adversity in general, or more specific terms, you have been faced with in life before you came into the field, that brought you into the field. And before you answer that, just another little addition. I know that in the 60s and 70s you sort of had a lot of contact with encounter groups.
Yes.
before you went into REBT and Albert Ellis's work and so
Sure,
on.
sure.
I wonder if you could let us know a little bit about that time.
Yes, I think the some of the adversities that I experienced, which perhaps were relevant to me taking up a career in counselling psychotherapy. I think the one that I normally refer to is the fact that I still have a stammer. It used to be much worse than it is now. And at school, I experienced some words comes up to mind would be piss taking.
Yeah.
I don't know whether that is the same as bullying or what, but and it occurred to me that people who I would be friendly with individually were also joining in the piss taking when they were in groups. So I got interested in what is it about being in a group that makes people who've been friendly with you one minute to be nasty to you another. And that led me to be interested in the field of social psychology. But I think being an only child, I think that's probably a sort of significant factor, led me to kind of think about things and experience, emotions privately and try to work things through on my own. And when I came to choose a subject for university study, which was psychology, it was in social psychology at the LSE, and then I did a PhD. But I was chose an area called self-disclosure because I think at that point I was quite influenced by encounter groups and the sort of movement towards authentic relating.
Mm-hmm.
And self-disclosure was just being studied by a man called Sidney Girard, who was really sort of central to the humanistic psychology movement in America. And I did go to quite a lot of encounter groups. In fact, there is probably somewhere, if it exists, in the archives of the BBC, a programme of encounter groups in which I feature.
Wow.
Just kind of briefly. But,
Wow.
so yes, I was sort of interested in that area. And Sidney Girard was kind of interested in humanizing psychology. So the idea was that if you develop an authentic relationship with your subject, that would affect the relationship, the kind of the behaviour of your subject, in quotes, and that you'll get different results than if you treat your subject as an object. And I started off my PhD full of enthusiasm that I was going to sort of, carry on in that tradition. But like a lot of people before me, I got kind of bogged down and did a PhD on to see whether the reciprocity effect, which is the idea that I would disclose to you and then you would disclose to me back, can be explained by the demand characteristics of the situation rather than the reciprocity effect. So it got all kind of quite technical. But during that, I got interested in the idea that there was quite a lot of self-disclosure research in counselling. And this idea of actually you can help people through counselling was something which appealed to me. And I did some Nightline and some Samaritan volunteering. Then I went on a course which was run by South West London College with Bridget Proctor. Didn't finish that because I went to University of Aston in 1974 rather, to do the one-year diploma in counselling and educational settings. Now that was in the day where 1 year was really 1 year. It was and it was full time.
Yeah.
Now, 1 year means a couple of days a week. Then it meant 5 days a week. So we had a thorough training in person-centered, what's now known as person-centered therapy. It was a person-centered course, and I was very drawn towards client-centered theory, not so drawn towards client-centered practice.
Yeah. What was it about the practice?
I didn't feel authentic.
Yeah.
I think there was a number of restrictions that you really had to stay within the client's frame of reference. You couldn't, it was, any supervision you got, which we actually got quite a lot on our tapes. The real to real, not anything else. Was that you've responded from your frame of reference rather than from the client's frame of reference, and I just found that I just felt kind of boxed in and inauthentic practicing person-centered therapy. I experimented with a bit of psychodynamic training, which I didn't get on with, and at that time, the tutor at Aston, a guy called Richard Nelson Jones, who's a very famous author, and before he had started publishing his books, he actually kept and handed out quite meticulous notes on different theories, and we actually studied other theories, and I got drawn to the work of Albert Ellis. I seemed to resonate with it, quite a bit, and when I did come to train, it was in rational emotive behaviour therapy. At that time, it's called RET, rational emotive therapy, in New York in 1978.
And did you feel at that time that you could be authentic even while you were training?
Yeah.
Okay.
I think it was.
And what was the difference then for you as far as authenticity was concerned?
I think that as I say, I think that the other therapies, I think, are quite prescriptive about what people do and don't. And I find that for me, you won't necessarily find that have a different persona within therapy and outside therapy.
Yeah.
Whereas when I was practicing person-centered and psychodynamic, I felt very different inside and outside therapy. Certain things you can't do, you can't ask questions, you can't do that. Whereas I think with REBT, I don't experience those kind of levels of actually prescriptiveness.
Yeah. That's curious in a way, isn't it? When REBT has quite a clear process of questioning as well in the whole notion of disputing people's beliefs.
Well, yes, I mean that it's a bit, in a way, that's true, but it's like any person with growing expertise learns to develop and use it within their own style.
Yeah.
And I didn't really kind of experience any. Actually, I did when I went to train. I did. Probably one of the first British people who went to Philadelphia to train with Aaron Beck at the Center for Cognitive Therapy in an extended way. I had a 6 month sabbatical there. Now, it's interesting because there I like to use, where appropriate, humour in therapy, and that again was sort of frowned on within that therapy at that time. And I just, thought that again, this is yet another restriction. And I think that, in a way, if you are to be authentic as a therapist, yes, you do have to recognise you're there for the person. You're not developing a relationship for yourself in the same way as you would. But within that, I think a therapy might encourage you to be authentic or discourage you. And for me, the REBT is a therapy that can really hold my individuality more than the other therapies.
And again, taking a concept from humanistic psychology, which is sort of can be found in REBT, but I'm not sure how it's lived in REBT, is the concept of unconditional positive regard.
Right. Well, the REBT version of that, if you like, is unconditional acceptance, which is, in a way, an attitude, a stance towards human beings that reflects their fallibility, their complexity, their fluidity, and trying to come up with a stance towards the human being which embraces those qualities without judging the person positively or negative. No, unconditional positive regard, just the words, indicates that there is an evaluation, you are making a judgment,
Indeed.
and that it's positive.
Yeah, indeed.
Now, I think what the important thing in unconditional positive regard is the unconditionality.
Yes.
That nothing can detract from this positive regard. You may kill 6 million Jews, but you're still unconditionally positive regarding the person.
Yeah.
In REBT, again, what is important is the unconditionality. You're not positively regarding Hitler, but you can accept Hitler as a flawed, disturbed human being who's done lots of things. So, you know, I think that I think those two concepts are interesting because there are parallels in terms of unconditionality. I think where they differ is in terms of acceptance is posed as something which is neither positive nor negative. It's just an acknowledgement of the fluidity, uniqueness, fallibility, complexity of the human being, whether it's self, others. And I think so there's that kind of difference. I think it's very difficult for human beings to kind of, again, it's a process. You don't actually say, oh, now I can accept myself and other people fully. It's a journey. It's a process.
Yeah, and you've kind of indicated now in the last bit that you said that it's kind of this psychoeducational process that REBT leads or tries to encourage people to take towards themselves.
Well, this is one of the things that I personally like about REBT, which I know that it's virtually the same thing which other people don't like. And I think what I like about it is it's quite upfront and explicit about its views.
Yeah.
And its sort of image that, and the idea that these sort of ideas can be taught to people. Now, I think the important thing is, and I think the real therapy goes on, how people respond to those, you know, points of theory and practice, which they can take on and apply. And I think that, so for example, when you come to teach a concept like unconditional acceptance, now, having said teaching, I think it's important that the therapists model that in their interactions with their clients. But you can teach it, you can encourage clients to learn how to do that, but it's how people react to that. So some people say, well, I can't unconditionally accept myself because if I do, I'm letting myself off the hook. So you can have a nice discussion about, you know, okay, does it mean that? Okay, so I like its explicitness because I think I think the more explicit you can be in therapy, you know, the more ethical you can tend to be, in a way. And I do think that Albert Ellis was a genius in coming up with a whole host of ideas, which, you know, if applied by people, you know, can actually lead to greater human health and happiness.
Yeah, and about being explicit, there's no fear, is there, in REBT, of repeating processes, of coming back, of bringing the client back to make sure that they've actually really learned whatever it is they need to learn in accepting something.
Yeah, I mean, see, my actual kind of my own development as a therapist has always had this sort of specific general aspect. I've 1978 I did a 2-year master's in psychotherapy at the University of Warwick, which was an eclectic course with John and Marcia Davis, and that introduced me to some important theories like working alliance theory, which has stayed with me and I've actually helped to develop myself. So I've always had this sort of touchstone with REBT and with the more general zeitgeist of psychotherapy to such a point that now I'm quite happy to really sort of ally myself to some degree and support the development and movement towards pluralism.
Yeah.
And I think that the idea that, for me, you can have a specific idea about what is helpful for people.
Mm-hmm.
You can be clear with clients about what that is. You can
Mm-hmm.
teach them if they're interested.
Mm-hmm.
But it's important for you to kind of never lose sight of the fact that clients have got their views, and you
Mm-hmm.
can have a discussion about the differences, a therapeutic discussion,
Mm-hmm.
not just a theoretical
Mm-hmm.
discussion. And out of that, you can shape a therapy which reflects those two inputs,
Yeah. Yeah.
and that's what I kind of like. So I'm actually have joined forces at the moment with John McLeod and Mick Cooper.
I was just going to ask
Yeah,
you whether
we-
that's what you meant by pluralism.
Yeah, I think their book Pluralism, Pluralistic Counseling Psychotherapy, for me is probably the most important book to come out of psychotherapy for quite a while. I recommend that even more than I recommend some of my own books. I think as a result of my interest in pluralism, that has really enabled me to continue being specific and general when I engage in continuing professional development activities. And I think for me, that specific and general mix
Yeah.
works well for me. It may not work well for other people. It may be frowned upon by some organisations,
Mm-hmm.
but for me, I do thrive within an organisational setting for an organisation that allows me to pursue both specific and general continuing professional development as CPD and to count it as such.
Yeah. I'd like to read a little quotation going back to Epictetus, Aurelius and Russell, so on, and the notion that REBT is applied philosophy
Okay.
as well as psychology, and just the simple quotation that as humans we are not made disturbed simply by our experiences, rather we bring our ability to disturb ourselves to our experiences.
Yeah.
Now what I'd like to do is ask you about that in relation to our profession and what our profession needs to attend to in the way we disturb ourselves by our current beliefs, and where, in your opinion, we need to go.
Well, I think, it's one of the things about the field of psychotherapy. It's not necessarily been its own greatest advocate for some of its ideas, but I think that if we take, I think in a way some of the ideas of pluralism, which I think is an antidote for us disturbing ourselves as a profession, and that is, number one is you may have specific views about how human beings function and how best to help those human beings, but that in all probability that's not the only perspective, and you might regard that to be the best, but that doesn't mean that other people are not going to regard it as best. And the most important attitude to take in dealing with people is to respect our differences, and I think that involves us being flexible. And the way that pluralism is, it says that there's no one universal pathway to change, that there's several pathways to change. And the more flexible that you can be towards your own therapy and towards what other people do, the better for our field. That would encourage dialogue. That doesn't mean that you necessarily, agree with that. But, we're not in a field like sort of medicine and where, if we take out the ideas of witchcraft or anything like that, the idea that there's probably a universally agreed way to treat various specific medical conditions, although some people will argue that is not the case. For us, it's not. And I think that in a way, just because an approach to therapy has not got empirical evidence to support it, it doesn't mean that it's not effective. It just means that it has not, sort of deemed to take part in a process to actually study it, and that doesn't mean that it should be excluded from from the therapeutic narrative. So I do think that, in a way, why I support scientific research in psychotherapy, again, I don't regard that as the be all and end all.
Yeah.
Because we're also talking about an arena where people have their own perspectives, which can't be reduced to universally accepted scientific principles.
So for you, would qualitative research be just as justifiable?
I think a combination of the two.
Yeah.
It's not, again, one of the pluralistic ideas. It's not either or. It's both and.
Yes.
So I'm quite happy to actually look at qualitative and quantitative in a research, and I think they taken together.
Yeah.
That's the way to go.
Yeah.
So I think that the conditions to try to avoid is rigidity. To say that there's only one particular sort of paradigm to which to understand developments in psychotherapy, and that there is and that there should be only certain therapies offered to people, whereas I think if we take a pluralistic perspective, that offers another viewpoint on that.
Yes. I guess REBT might not suit everyone, might not suit every type of client. And I'm wondering what issues or what kind of clients, in what cases then REBT might be contraindicated.
Well, it's not about particular conditions or particular problems, but I think, again, what particular ways of people consider to be helpful and what they can engage in. For example, I've got a cartoon which nicely sums that up, and it's got this guy who's holding 3 guns and 4 knives and things like that, and he looks angrily, and the caption is, "I soon came to the impression that I was in the presence of a man unaccustomed to using reason." So that idea that and that's fine. I mean, if we had anybody saying, "I've invented the therapy which is for everybody and everybody can use it," I'd be very sceptical.
Yeah.
I would expect quackery going on there. So I think the main thing though is in REBT you very quickly, because you're quite happy to make explicit what the process is likely to be or can be, what the ideas are, what this is going to mean for the client, and then the client can say, well, actually this is exactly what I'm looking for, or no, or I'm not sure, can I give it a go?
Yeah.
And off we go. So I mean, yes, it's more about what people have in their minds about what's going to be helpful to them.
Yeah.
And don't forget, Ellis's first book wasn't just called Reason in Psychotherapy, it's Reason and Emotion.
Exactly.
In psychotherapy, and that emotive and the behavioural aspects, which, had never been neglected.
So if I were interested in doing some CPD in REBT, Windy, how might that go?
Well, I think that certain introductory levels of training would focus on an understanding of the theory, of course, the learning of a particular sequence. So, for example, one of the things that I think REBT, and I see REBT as a specific approach within the broader tradition of cognitive behavioural therapy, which I see not as an approach but as a tradition.
Yeah.
I think one of the features of this tradition is at the beginning of the process you'd start off with identifying problems, setting goals, and then maybe working with working with specific illustrations of those particular problems.
So
one at a
that
time.
specific illustration might be, for example, can you give an example of a particular belief, I guess?
Well, the belief would actually come out of that. But so, for example, let's suppose somebody has come because they find it difficult to be authentic in relationships. You would start off by identifying a particular relationship where they've experienced that difficulty, and maybe sort of getting a specific example of that lack of authenticity, and then you can use what has been universally called the ABCs of REBT, which I think practitioners, specific trained practitioners, would use sort of seamlessly, when people who are novice would probably use it in a more sort of technical, structured way.
So the A would be the situation.
Well, no,
or
because one of the things that I make a distinction between is the situation that you're in, and the A would be, what is it that you are particularly disturbed about in that situation? So in REBT, we would generally, on a CPD, encourage you to start off by identifying the person's emotional reaction. So rather than talk necessarily about lack of authenticity, I say, well, okay, in this situation, how would you feel if you were more, and the person will say, well, I might feel anxious. So I react to that anxiety by sort of shutting down on my authenticity. So you might say, okay, now if you were authentic, what would you be anxious about? Now, what they would be anxious about would be the A in the REBT sequence, the ABC sequence, and then you then help them to understand that it's not the A that has produced the C, but it's their belief about it, about the A. So in REBT, we would generally be looking for some sort of rigid idea about how, in this case, the person believes that they have to be, or they have to be accepted, and therefore they can't, show authenticity in case they're not accepted. And then you'd look at the evaluative meaning about what that lack of acceptance would be. Might be a judgment that they would make about themselves. Then you would actually help them to kind of locate the idea that in order to change their reactions, the best way of doing that is to stepping back and looking at their beliefs, developing a more flexible and evaluative type meaning, which is again not extreme, and then helping them. This is where the actual change process comes on. Otherwise, it just becomes an intellectual exercise. How they can put that into practice? How can they strengthen their conviction in these developing, flexible, and non-extreme beliefs?
And how would they do that?
Well, by actually sort of approaching a similar situation and acting in a certain way. We see without I once wrote a book review actually, which I called Cognition Without Ignition, and I think the ignition is the behaviour. So when thinking ignites with behaviour, emotional change will occur later, but it will occur. And so therefore, having people to actually act in a way that they want to act, while holding in mind the belief that they want to strengthen, and staying in that situation. The new belief. Staying in that situation. Now, the beauty about the actual process is that people often rely on a whole host of ways of keeping themselves safe in that situation, which actually would stop them from their defensive, their safety-seeking manoeuvres. And we would, very carefully look at that and help your client to actually not use those. And again, it's often about encouraging people to put up with the discomfort of doing things differently, and to be in a situation that if they tolerated the discomfort will lead to change later. So I think there is that sort of element. So hopefully that gives a little taster about how how you might learn how to, utilize REBT within that particular context.
Yeah, and in addition to that, of course, you might also work with meta beliefs, beliefs about the beliefs as well.
Oh yeah, people have, you see, human beings are, as Albert Ellis jokingly said, we are talented screwballs, as he would say, his language. And that is, we not only disturb ourselves about events, but we disturb ourselves about our disturbances, and we can disturb ourselves about the beliefs that we hold. So yeah, we can have, a whole host of disturbances, which hopefully will keep people like me in business for the rest of my career.
So I'm wondering where you would steer people to find out more about that.
About REBT?
Yeah.
Well, I think the best place to start would be Albert Ellis's sort of seminal book, which originally came out in 1962, which he updated and expanded in 1994, called Reason and Emotion in Psychotherapy. I might also humbly offer some of my own writings on the subject, perhaps Rational Emotive Behavioural Therapy in a Nutshell, which I did with Michael Neenan, my colleague. Yeah. So, I mean, there's quite a lot of books, that people can actually get involved with. By the Handbook of Individual Therapy, which I'm working on now with Andrew Reeves, which is going to come out as a 6th edition, which is going to be my final time I'm going to be involved in that project. Andrew's going to be taking over from now on. We'll have a range of therapies, including REBT. If people want to have a look at a comparison between REBT and other therapies based on a common chapter structure, I think that would be something.
Yeah. And that's very helpful, because at the back of the book as well, there's a clear structure for each of the therapies, isn't there?
And that's what is given to the writers.
Yeah, so it's
now,
very
of course,
easy.
we have sometimes a struggle getting the writers to use the structure. Some people don't like using structure like that, but
that's right.
But we kind of managed to
persuade them.
Yeah, persuade them nicely.
Thank you very much, Windy, for this talk, and I hope people enjoy it and learn from you and continue to learn as well.
Thank you very much.
Thank you. A great note to end on. Thank you.